Elizabeth, thanks for joining me on the pod. It's great to have you. And I just think it's kind of neat over the last few months, how we connected with the conference and just finding even before we started recording that we might have more passions that align as we go. So why don't you just tell everybody a little bit about you, a little bit about your story, what you're passionate about, and then we'll get into some more nuts and bolts.
Yeah. Well, thank you. I'm excited to be here. The little bit about me is always the funny statement that I have to decide how to answer because I'm actually a missionary kid. And so that's one of those that for anybody who's lived in many places, that kind of tell me where you're from type question actually ends up pausing our brains because we're like, well, there's so many answers to that. But there are so many answers to that. But I grew up kind of between California and Texas, and then went overseas when I was in middle school and high school, and came back for college. And I'd always known I was going to be a helper of some sort, but that really shaped my outlook. I thought I was going to be a vet. Did a lot of animal work while we lived overseas. My dad was an agriculturalist and did a lot of development work. But then I met my high school psychology teacher and his wife, who were actually LPCs who were working at a missionary school. And just kind of through his class, which looking back now, I realize is essentially the high school version of interling and theories, which he just kind of gave us the rundown and put it through a biblical understanding and showed us how psychology and theology work very well together and show us how God created the human heart. It just kind of excited me. And I told my mom when I went home that day, I was like, well, that's the first thing that's excited my head and my heart. And I kind of never looked back. So I went straight through college for psychology and then my master's for clinical counseling. And then at the time I was single and bored. And so I thought, he sounds fun. And God has a sense of humor. I said I was never going to teach. And he said, okay. And then promptly put me in touch with and then eventually married another PhD student, soon to be professor, who found a job here at Charleston Southern. So we moved from Texas over to Charleston, and I go and I talk to the counseling program department. I was just looking to meet counselors in the area. And after about 20 minutes, they're saying, well, what do you want to know about the job? I'm like, what job? And so I got a job here as well. So I've been part of the program, the counseling program here since it started in 2018. And it's just kind of been this adventure of, that sounds like fun. And then we do it. And I kind of see where God takes me. So I didn't know what I wanted to go into in terms of mental health, but God put me with an amazing mentor who, on this side of it, we all look back and we're like, if you were one of her supervisees, that was a really big deal. But she was so unassuming that you wouldn't know it. She is a phenomenal counselor and trauma-focused, trauma-informed, works with trauma. Her specialty is domestic violence. And just the way that she has taught us to see clients and see the world essentially turned me into a trauma counselor without me realizing it. The understanding of trauma always fit for me. What happened to you versus what's wrong with you, and how most of what we would say is wrong with us is actually a symptom of something that if we can heal it, sometimes those symptoms can completely go away, much less be very, very reduced instead of treating the symptoms. So I work with any diagnosis in the book, but I'm looking for what's the trauma? How do we heal that trauma and go from there? Professional.
We talked a little bit before we got on here about just an integrative approach to treatment, but when I first started, I started to tell you this, but when I first started, I had a practice called Charleston Integrative Counseling, and I worked with midwife, and we were really looking at root cause nutritionally too. But I think in terms of trauma, what I've found in just being a therapist for all these years is my root cause kind of mentality always takes me to trauma. No matter where we start, there's always something deeper there that's that a belief is rooted in, that a reaction is rooted in, that's trauma. And so give us your, I mean, I feel like this question, you ask 100 therapists this, and, we can give the textbook answer.
Right.
But I think we all kind of have a way that we sort of define what trauma is. So can you define it?
Mm-hmm. I teach it. I love to teach it. And I run a lot of advocacy that we may end up talking about. But to me, it has come down to anything that overwhelms your ability to cope. I think I pulled that from one of the textbooks, but just the way that fit for me, I mean, it explains adjustment disorder. It explains anything in terms of right now, my resources and the situation are not matched.
Mm-hmm.
And the more that I've worked in this area and done with this, I've come down to 3 pieces because I work with medical trauma and ongoing trauma now. But basically, it's anything that overwhelms your ability to cope, I'd say, and challenges your sense of safety, predictability, and control. And so just because I feel like I got knocked down by a wave, if I'm not worried that I can't stand right back up, that might just be annoying. I might get a mouthful of salt water. But if I'm knocked down and my feet can't find the ground and I don't know where I'm at and I'm feeling at risk of my safety, my control, or I don't know what's about to happen, or I don't know what's going to happen, my predictability, that becomes traumatic. So it's a very loose definition in terms of its impact. And when I think about trauma, I'm looking at the proof is in the product. And so we can all experience things that may not be traumatic for you, that may be traumatic for me, vice versa. And so we're looking at that impact. And I have found it generally goes back to those areas. Those are big nets, obviously, but almost all of our core beliefs that are going to be rooted in those areas are going to come down to who and how do we stay safe, who keeps us safe, do we have some control, what do we have control over, even if we don't feel like we have control over ourselves, and can we have any sense of predictability of our world, because that's what our brains are built on, and that's the way we see the world and understand the world. And so when those things are challenged, trauma happens.
Yeah. That's so good. I feel like too, as you're talking, I get like these different spheres of the way we store trauma, like the way people, it's just so different. So can you talk a little bit about trauma storage, and as a therapist, kind of how you start to see that stuff come out, and how you recognize like, okay.
Storage, what do you mean? Say more.
I'm thinking cognitively, I'm thinking somatically, I'm thinking emotional reactivity, kind of these different spheres of places where my trauma might live. And
I'm a very analogy-based person, so you're going to hear lots of those. Very practical thinker. And so the best analogy that comes to mind, or there's 2, I guess. I use the one a lot of pushing all the balls underwater here. So like when you're trying to control, or at least get control of whatever's going on, and we're kind of just like in a swimming pool pushing down as many balls as we can. They're going to pop up everywhere else. And so to me, a lot of what I see in clients and I recognize as coming from a trauma might be popping up over here in their attitude at work or their physical stress. But it's actually the things that they pushed down over here that are affecting that. And so I'm going to look for those symptoms. Sometimes we can directly trace the root like we could with core beliefs, but a lot of times it's just a pressure level, like that they have shoved so much down instead of deal with it. But too often that happens because we're hurt. We don't know that we're hurt, and we just keep going. So my daughter slipped and fractured her wrist 2 weeks ago. Typical 4-year-old who is full of energy, and she stopped at least to acknowledge that it hurt more than normal. But the next thing we know, she's just up and going again, and so she falls on it 2 more times in the same 3-day period. Because when something hurts and we don't heal it or let it heal, we just keep doing the same things. Not saying it's our own stuff that got us into trouble, but we keep doing what we're doing. And it's like falling down onto it again and again and again. And so it gets stored in a ton of places. So for me personally and professionally, I definitely see the health impact. I know the rise of autoimmune in our society is largely due unregulated nervous systems and trauma and things and cortisol and hormone, just the autoimmune epidemic. I have them. I treat people with them, and to watch and see how that's just the body saying, I can't, like, I've got too much, you're doing too much. And so for me, it's physical pain sometimes, but just autoimmunes just cause inflammation, which then can affect anybody in any different way. And kind of figuring out where that comes up. And then those cognitive side, those really deep beliefs of, I can't do this, I'm not good enough. All those things that are just chipping away at the strength we need to actually cope with things. And so if it goes back to our lack of ability to cope with whatever's going on, those are some of those things that kind of chip away at that.
Yeah. I'm really glad you said something too about the tie to actual illness. Because I think that's something, and that's just kind of a product, I think, of where we are right now with just a lot of what we've been taught in the last however many years with allopathic medicine is there's just such a separation between like the emotional piece and the physical piece. And that's just not true. I just in my own interactions with clients, I would need both hands or more to count on the people who have reported to me that when they come out of a situation where they were just experiencing extreme hypervigilance into kind of a place of safety. I'm thinking of my people who have been in domestic abuse situations and those types of things, how they were like, my GI issues have gone away. Right. And so they start to tie like just some very things that they were actually, I had one lady who was ready to see a specialist, and then she got out of this situation. She was like, you know what? Like, I just haven't had any issues. Like, I thought I really was going to need surgery or something.
That was one of my most fascinating cases while I was in LPCA, was a college student with chronic GI issues that could not be explained. And it was literally our only measure of how stressed she was in session. So looking back, this was my nervous system thermometer. But like, we would just talk about things and figure out, we would just rate her nausea. She was in this horrible cycle of nausea, taking medicine for that, causing her to sleep through her classes, missing class, and as we worked through it and as we got closer to that nausea, we found childhood trauma that was being remembered. And in that time, though, process through that, we realized that she didn't like her major. She wanted to change her major and all of these things. And by the time we were done, not only was she not dealing with any stomach issues at all, she was in a major she loved and becoming an advocate for others. And it was just like, that was all we knew, is that she thought she was coming in for the fact that she doesn't know how to cope with her stomach issues. And yet there's always more. So I send my people for medical checkups to the right doctors, like people who actually understand thyroid instead of just one look at thyroid. And I know a whole lot about it. I had a teenage client that I finally got her mom to check her, and her doctor called the mom like, I don't understand how she's physically standing. Like, her levels are so bad, her muscles should not be functioning. And she was passing out at like track practice and stuff. And on the days she would take her thyroid medicine, her anxiety was significantly better and something that could be managed. But when she wouldn't, it was just kind of out of control, which, like I've mentioned, medical trauma and this overlap and ongoing trauma has kind of been my focus personally, that God has turned into a professional focus. But understanding how we cope with the medical side, but also this ongoing of medical issues and how we cope with that mentally is so intertwined. And I'm spending a lot of time kind of understanding that and looking at that personally and now professionally.
Let's talk about that a little bit, because what's coming up for me is I'm thinking about parts as you're talking, and let's talk about a little bit, how do people know? Because clearly this client that you mentioned, she was attempting to cope, but it was kind of what you were talking about before, like she's pushing all the relevant balls under the water here. How do we know when we're coping in a healthy way and when we're not?
That's the $1 million question, right?
Right.
Um, so again, I'm going to use an example. So my son is medically complex, and it has been a journey of more than his 2.5 years outside of my womb. But I have come to the point where when I'm trying to figure out if I'm reacting from stress or trauma or worry or uncertainty, I sit here with all the symptoms and all the energy, but I don't know what to do about it.
Okay.
And so I feel like I'm spinning my wheels. And yet the times when something's going on, my mom instinct tells me, hey, we gotta pay attention. I have a little more purpose to my energy. So I have learned that, especially with ongoing work, the goal is not to just sit and be calm and quiet all the time. Like, that's not realistic, right? Every time he coughs, I have to assess what do we have going on. But I can determine that I'm coping well when I can say, all right, I recognize where we're at. I recognize what needs to be done. I know what the next step is. I know what the next step is after that. And so that I have a direction for my energy. It's when I'm sitting there spinning my wheels that I don't feel like I can do anything. I can't set it down. I can't decide who to call. I can't figure out what to do next or where to go, that I get stuck. And so when I've worked with trauma for so many years, walked with some amazing cases, like literally showed up the day after her boyfriend committed suicide and threatened to kill her. But we walked through this in 6 months. She had an amazing support system. And we got to the point that she didn't get stuck. And that's what we had just talked about, was like, let's just not get stuck, since we're actually getting to walk in on day 2 and walk through this. And so she never met the criteria for PTSD. She walked through all the symptoms. She walked through all the reactions and got to a point that she was back in school and back at work and back happy and healthy with a family that was very supportive in 6 months. And so it's about what you can do with that energy, that we could get stuck and spiral, or we could move and be productive.
I think that's such good imagery. I was sitting with a client yesterday, and we were discussing this concept of, she was calling it like, how do I know if I'm in God's will or not? You know, this idea of, this was a fear of hers, or am I in or out of that? And we talked a little bit about, what does it feel like when you are, and what does that mean to you? And one of the things she described it as, I thought was so beautiful, was like, she said, when I feel like I'm in God's will, I feel like I'm in a river, and I'm just kind of, I know that I'm flowing. And she said, when I'm not, I'm turned in the other direction and I'm grasping. And that, your language of stuck, like that feels like I'm grasping out of fear. It's not that there aren't challenges or things that I have to maneuver, but I feel like I'm flowing. There's an absence of like, kind of that striving.
Absence of fear.
There's an absence of fear.
Because in my quiet time this morning, the book that I was listening to is called River Dwellers by Rob Reimer, that is talking about that, about how we can be saved, but not be continually flowing in the river. Like, that's a day-to-day, moment-to-moment adjustment of how do we get in that, because God's moving. Like, I've done word studies on the, wait on the Lord. That's actually an active verb. That is a verb about leaning into, pressing into something while we wait. And so it is not just sitting here twiddling our thumbs. It is going along with where he has us until he tells us to do something different. And that should be, easy is not the right move, or easy is not the right word, but it should be clear. Again, just like with my son, like when I'm looking at, am I hypervigilant or am I appropriately vigilant? The difference is, I know what I need to do and I have the energy to do it. Even if I'm scared, even if it's hard, even if it's not comfortable, I know what I need to do and I have the energy to do it. And what's hilarious is, I've spent a lot of time in ambulances and the ER. I end up sharing about mental health to them. Like, I've started carrying cards, because I've given cards to EMTs of like, hey, I can help you find a therapist who works with first responders, because I'm sitting there in the ambulance with them dealing with a son who's trying to breathe, and yet I'm calm enough to have that conversation,
Yeah.
and it is not forced,
Yeah.
but it is just natural because I'm in that, I'm functioning. First, I'm sitting here panicking. And I've had a few rides where I was sitting there panicking. I was
Sure.
sitting there crying and didn't know what was going to happen next, didn't know what to do. But I get practice at repetition and say, okay,
Yeah.
well, if it's going to happen again, how am I going to do that differently next time? Last time I actually had time to make my coffee, and I'm sitting there with my coffee at 2 a.m. in the ambulance and along for the ride.
Yeah. And I think I love what you're saying there, because it reminds me of just kind of, you're taking the lesson, you're leaving the shame, and you are kind of learning and growing, and you're able to get back into that window of tolerance just a little bit quicker each time. So talk about that. I mean, that's a lot of inner work within yourself. That's a lot of, okay, being triggered and kind of being brave enough to learn from the trigger. Like I heard somebody say a couple weeks ago, and I just thought, yep, that's it. A trigger is an invitation for deeper healing and deeper like self-understanding. We don't need to be afraid of the triggers. We need to see them as an invitation from the Lord to, like, there's a part that is kind of calling out when we're triggered, that wants to be closer to Him. So talk about that process a little bit for you, and what that's been like.
So what's interesting is that to even get to that, thinking about it from a treatment perspective, I had to do a lot of work with the core beliefs first.
Yeah.
I can't believe that's bringing up some emotion, but I think it's a gratefulness at looking at how far I've come. So my son has Down syndrome, and growing up, I'm a kid of the 90s, and at the time, all that was ever taught in biology classes was that Down syndrome was because a mother was too old. Like that was all that I managed to take away from. And so the whole pregnancy, knowing he had Down syndrome, the adjustment time, NICU definitely impacts your ability to bond, because I couldn't hold him and I couldn't be there for a couple weeks because my daughter was sick. I had all those core beliefs on top. It's my fault. Something's wrong with me. I did this, that I had to work through. And so I had an amazing therapist that I sat there, and at the time I was able to say, I can't even see him to do any of that deeper work. I can't see him enough because of all this mess. And so I sat there and said, we got to deal with that mess. We took its typical rabbit trails, unhooked a lot of things in the time I got trained in brain spotting, and I participated in that as well. Unhooked more and more. And so in that cycle of his ambulance and hospital rides, we went from, I would go in and not sure if we really needed to go in, afraid that the doctors would think that I was overreacting, yada, yada. Getting through that shame, I like the way you worded that, to the point that now my core belief is, I got this, or rather God's got this, but I can do this.
Yeah.
This isn't my fault, and that I'm going to speak up for him. And so to even get to that work of being able to recognize the triggers in every moment, I had to work through those. Of course, they're not 100%, but they are sitting in a corner now instead of everything that I'm doing. And so I'm even aware when they raise their heads. And so that's one of the triggers now. Instead of being just completely, my whole lens was covered by that belief, it's an understanding. So first, had to deal with some of those. And as I'm working on creating a model of how to help parents in these situations, it's two-part. It's trauma to process and the stuff we have to grow with. And so getting that understood and figuring out that was a critical piece. And then I had to start recognizing when I'm stressed. And my overwhelm comes out as spinning my wheels, snapping at people. I tell my students this all the time. I don't know if it's an introvert thing or an INFJ thing, but the second I feel overwhelmed, I pull up my calendar and I say, what can I cancel? And I just start canceling things left and right. Because even though I'm like, I probably would be awake enough or have space enough to do that tomorrow, my brain right now is like, what can I take off my plate? And so I will notice that I'll be canceling, I'll be stressed. And so I work with clients and I teach people, sometimes your sign of dysregulation is recognized by others first before you. And so getting better at figuring out what that looked like, learning what my symptoms were. So if I'm sitting there canceling and having to communicate, hey, so-and-so, I'm sorry, I can't do this. I even have a few friends who are willing to be like, what's up? Why are you canceling things? If you really just need to sleep, cool, gotcha. But if you're just thinking you can't do this, like sit down. And so it has been a lot of inner work, but I'm at the point where now I can kind of sense that dysregulation. And if I will, I can sit and turn and kind of go, all right, what's got me upset? And figure that out. But it takes a lot of time. It takes a lot of work, journaling, of moving through, even recognizing what the fears are. And so, like one good example, I had everything about my son's sleep has been a journey. And so one day last year, I think I had an appointment with his sleep doctor that did not go as I had hoped. And it was like a virtual appointment in the morning. And the next thing I know, I'm in a bad mood all day long. Like I was snapping at everybody. I was uncomfortable. I didn't even recognize it as anxiety. I was angry. I was sad and I could not figure it out. And then the technology at my work like completely locked me out of all of our systems, including the only way I could reach IT was to sign into the system and submit a request. So like I'm like driving to campus, raging at the fact that I don't have any way to call to figure out how to get unlocked in the system. And so God made me sit there and go, you want to talk about what we're really upset about? And it took 5 minutes to say, yeah, that sleep study appointment was really frustrating and really discouraging. And I felt like I have no recourse. I have no idea of what to do next. And it's like the energy just went out. And he's like, yeah. And there wasn't even an answer in that moment. It was a year of a journey. We just had another sleep study. But it took all day.
But it was the part of you, the vulnerable part of you communicated.
Yeah.
And then from that is freedom, when we put our protectors down and we allow those vulnerable parts to unburden. Yeah.
And then so fast forward to a year, I was looking at my calendar about a month ago and saw that a sleep study was on the calendar, and I hate passion. And it took me only 5 minutes from start to finish. I was in a meeting. I was looking at the calendar because I was trying to schedule another meeting. I feel this huge reaction, get out of the meeting. I sit there. I'm like, whoa, what is that? Why am I freaking out? Then I was like, it's a sleep study. I hate sleep studies. I don't want to do it by myself. The day that it was scheduled, I was like, I can't do that because I have to be doing work things the next day. So it means I have to reschedule the appointment. But like that hopelessness of, I don't know what to do. I can't do anything about it was a minute and a half. It got my attention. And I sat there and I was like, okay, all right, I see what just happened. I'm going to move it. Like I have some power in this. I'm going to move it to a day that my husband can go with me. And we ended up just completing it a week or two ago. And he was able to go with me. He was able to help me set up. It was a different experience. Not thrilled with the results, but they're better than they could have been. And it's just this like piece by piece. And I ended up even having a conversation with the person who's supposed to help with some of the equipment. And they were being a little challenging and not sensitive about, well, it's my job to like see why isn't this working for you. And I said, you know what? Yes, but you're going to have to accept the answer of it doesn't work for me and my family as sufficient. And like a year ago, I could not do that. I would just say, okay, whatever, and sit there and be stressed and be overwhelmed. And so it has been a journey. And of course, I'm not 100% at it, but I've gotten much better at recognizing when that trigger shows up, what it's telling me, and what I can do. And sometimes the do is just acknowledge. Yeah. Just recognize it. And that's where I've realized a large part of this ongoing type work, it's grief with trauma.
Yeah.
Sometimes there's nothing irrational or illogical to process. Sometimes there's not a faulty core belief. There's just grief. There's just ongoing grief that we have to deal with this, that we have to see where things are not what we thought they would be.
Yeah. Yeah. That emotional resistance and kind of radical things, can be really empowering. But it's not easy to get there. I mean, there's a thin line between toxic positivity and true acceptance. You know what I mean?
so much. So much. And too many people who don't walk some of the same struggles try to encourage in a way that becomes toxic positive. I have found, so I use Brene Brown's video all the time in teaching about empathy versus sympathy, and how a sympathy response usually starts with at least. I was at dinner the other day with some people, and bless them, they were trying to be supportive. They really were. They know nothing about the mental health field. Like they were not in my field. And so everything that they were just asking for updates on my kids. And I noticed like 3 in a row, at least. And I kind of like, okay. So I kind of just, shifted the conversation. We were good. And later I told my husband, I was like, man, that was an at least. That was an at leaster. And the person was sending me a message.
An at leaster.
And he's like, yeah, I think I remember that, because I think I remember noticing that you shut down a conversation. And I was like, you could tell that. They didn't. And they were just like, okay, because they were trying to encourage. I know that. But an at least is going to take away from the pain. It needs to be A, full stop, B. Yeah. That is really, really hard. I'm full here stop. With you. There are some good things. And, because it's not one or the other. It's if it can't be full stop, at least make it and. But don't make it but. Yeah. Don't make it, well, that had to be really stressful, but I'm glad he's better now. Don't be like, you're home from the hospital. Good, I'm glad. And I'm like, actually, no, that's harder. Sometimes that's a harder place to be, because up there, at least I had support. I had help. I had people who were there to watch this. Now I'm watching it on my own. And so that fine line between support and toxic positivity, and we do it to ourselves. If we're not careful, we will at least ourselves. And
at leasting is a protector, and in a conversation, you're right. Like, we do it to ourselves, but in a conversation with other people, when it comes up and you are, I love how you've turned that into, what part of speech is that? Would that be a verb? I don't know. I need to ask my mom. I need to phone a friend on that. But anyway, when you've been at leasted, can we say that? Does that work? Okay. That's more of a protector for the person than it even is for you.
They don't want to have to sit with that vulnerability.
They don't want to have to deal with like the depth of what it is. And so the at least thing is really more about them than it is.
It is. You. And it's a cute video. If you've probably seen it, but if people want to look it up, it's literally 5 minutes or less, but it's this very cool visual illustration of empathy versus sympathy. Yeah. How empathy is getting down in the hole, is saying, I'm with you, I'm here. I may not be in your hole, but I've been in my hole. I can connect. And what you're offering instead of at least is, I'm here with you. I get it. Even though I may not get yours, I'm not claiming to say I've walked your hard. I know hard, and I'm willing to connect with that, versus an at leaster. It's this little character from up above looking down in. Yeah. And is like, let's go stay up here.
Yeah. I think he says, you want a sandwich? Like one time. Yeah.
You're trying to silver lining whatever's going on. And like that's the difference between positivity and toxic positivity, and trying to say, I'm here, I got it, got you. Yeah. It's funny, after your workshop, when it was that small activity and asking kind of what God would say to you, he's just continued to repeat the phrases, and what all he came up with was what I say to my kids when I don't know what else to say. So my son is still not verbal, he's getting there, but learning what he is trying to communicate has been the biggest journey in the world. And yet I find myself, when he's fussing, when he's grumbling, my instinctive is, I know, baby, I know. And then for my daughter, she had silent reflux for a year, and it was COVID, and so we're alone. She's my first screaming child, and instead of it's going to be okay, because I've caught myself before, like right when I became a parent, I'm like, I'm not going to promise something that's not true. I'm not going to tell my kids it's going to be okay when I don't know what's up. But all we ended up saying was, I got you. I've got you. And so I'm just hearing, I know, and I've got you. And it's like, I don't have to know what is known to feel God.
That is just a beautiful picture of like pure attachment. Like it's really those two phrases, like, I know, and I've got you. Like, I'm not going anywhere. Yeah. Yeah. What was just coming up for me as we were talking? I do want to say I will link to that video in the show notes for sure. That's a great one. There's actually, she has several little cartoon videos that are just really informative. I use them with my kids a lot too, my teenage. It's just really great and all education.
I think calling it an at-leaster, I can actually give credit. I think that was a client. I showed it to a college student once, and she showed it to her roommates and her boyfriend. And so they started calling each other out anytime they would start a sentence with at least.
Mm-hmm.
And so she came and be like, he was at leasting me. And I'm like, okay. But it was an amazing tool for them to laugh about it and turn it into, hey, try again. Rephrase your statement. That was not helpful. And she was just sharing it to everybody. I love those moments when you give clients something that seems like a simple resource and they just go and everybody all about it.
That's good. Okay, where do we want to go from here? And what time do you have to be done?
By 9:30, I got to be in the car. So,
all right. So we need to wrap up in maybe 15 minutes or less. Okay. What do you want to say that we have not said? And then we will land the plane with, who specifically do you want to talk to? Do you want to talk to parents? Do you want to talk to, who would you have a message for at the end? We'll land there, but is there anything that we haven't covered? I mean, we've kind of floated around a little bit that you want to say.
Probably the parents, yeah. So I guess, I can tell just a little bit more of his story that led me to this understanding and this journey.
Well, I feel like what's coming up for me is that same line. And so I think what's coming up for me is like really as just the importance of doing our own work as we're parenting. Being aware of like our triggers, examining those things, getting
it's so hard.
Yeah,
it's so hard.
Not avoiding our own feelings, like so that's what's coming up on my end.
So and then just kind of my lens and look at it is it's kind of medically complex. So I know I've hinted at different medical issues, but as I've figured out my kid's journey, I've been a trauma counselor for almost 10 years at this point. And so I started to recognize what was going on as we walked through their journey as trauma and as traumatic for us.
Yeah.
But the models that I knew weren't enough to try to say, how do I deal with this? How do I cope with this? And so my particular focus, because God has a sense of humor, and my way of coping is to take what I understand and try to apply it. And so I had a choice. So my son's pregnancy itself was very tough and traumatic. This is actually the time of year where we were walking through that, and it's always a heaviness because on Mother's Day 3 years ago, we were just waiting for him to pass. I was pregnant, but we were told that there was no chance of survival, and we could either terminate or they would check every week. He would pass. And 6 weeks past the point when anything could have or should have changed, everything changed. And the doctor comes in and looks at us and says, this baby might make it. And then continues to give us caution the whole rest of the pregnancy. But when he made it here, he was structurally all in one piece. He didn't have the heart defect or the other things they expected him to have. He had Down syndrome, and he's walked an interesting journey of things that are sort of related to Down syndrome, but not necessarily. So he walked through infantile spasms, which in his case has not turned into anything more neurological. And now he's walking with juvenile idiopathic arthritis. And like all the pieces that have gotten us there, there's been this we say it, the doctors say it, but it should be, but it's not. Like everything about him, it should be, but it's not. the day that I met the neurologist who was all excited that he had Down syndrome, because in that case, infantile spasms can be a much less terrifying terminal situation. It can sometimes be a nervous system reset, which wasn't a pleasant process, but we did it. But she comes in all excited. She's like, can I show my students things about Down syndrome? I'm like, okay. So she starts listing off pieces of things or physical features, and then she goes to pick up his hand or his foot, and she's like, people with Down syndrome have, oh, but he doesn't. People with Down syndrome have, oh, but he doesn't. And like that has just been the story over and over and over. And so how that has paralleled for me is to understand that something should work a certain way, but it may not. It does not. And so my understanding of trauma and how I teach trauma and how I treat trauma always starts with kind of that phase-based approach. Get safe and stable first, right? Any of the foundation treatments, try to walk you through that. But as this kept going, as I lived in survival mode, I was like, there's no way to get safe and stable. And the people who were trying to tell me to do it were making me feel like I'm doing something wrong that I can't. Because I'm like, this is not over. This is one thing after another. And so although he does have Down syndrome, where we fall is under medically complex. And so that's not specific to Down syndrome at all. There's so many kids that fall under that label. But the medically complex piece adds layers of trauma, our own experience, our past experience, but also every step of the way. I mean, every parent I talk to has fought doctors. Every parent I talk to comes out of the gate far more defensive than we need to be because we've been too submissive for a long time and we didn't trust our instincts. Like all of this, the system is so broken. So fighting the system, and then on top of it, even the things that are actually doing what they're supposed to do are traumatic sometimes. This is the problem with medical trauma as a whole. It's still just being understood, not even 10 years really in the literature, to clearly articulate that medical trauma is more than just, I'm vulnerable, this thing was hard for me. I mean, the process of things that are supposed to save lives can be traumatic in and of itself. I mean, I have to hold him down for them to do a breathing treatment so that he can breathe. That's not a pleasant process, but it's not like anybody's doing anything wrong. It's what has to happen, but it is still traumatic. It still impacts me. And so there's not anything out there yet for parents. The closest we get is caregiver trauma, which in psychological and mental health literature refers like adults caring for other adults, which is a whole thing and definitely important. But at the end of the day, usually an adult has had their own life. And so there's this very different dynamic when you're caring for a child. And in some cases, a never been verbal child or not verbal yet child. And so as a parent, you are figuring out and advocating. And so like every word we had, none of them fit. It's vicarious trauma. It's complex trauma. It's ongoing trauma. It's all of these things. And I was just sitting there going, something's not working. And so I've learned that, and I'm in a group for infantile spasms, because it's only like 1% of children with Down syndrome, I believe, who even have infantile spasms. So I'm in a group with moms from all over the world. And I had one from the UK reach out when I was kind of explaining parts of this. And she's like, is this why CBT isn't working for me? Because my counselor is trying to process my anxiety about how he might have to go back to the hospital. I'm like, yeah, because that's not irrational. It's not illogical. There's nothing about that is anything other than, yep, that's probably our reality. And a counselor who's doing anything except validating that is actually working against you because they're not saying, yep, that's a reality. How are you going to cope when that happens? What are you going to do when that happens? And that changes. So even my own counselors, I get a little pushy when they're like, okay, so what are you going to do next time? I'm like, I can have a list of ideas, but I can't guarantee that next time is going to look like this time. And so I have to have a variety of ideas. But so this understanding that parents are not taken care of, we're not supported, we are constantly living in survival mode. And so I'm working on a podcast called Parent of the Forgotten Patients, because we are part of the process. We are critical to the process. And yet all the mental health literature looks at kids. We're starting to get better at looking at medical trauma for the kids, but we're not looking at how it impacts the patient. And I've had a group of amazing doctors who take me seriously, but I've had to fight for it. And then I have some who have not. And then I'm working on a book, The Medical Parent Survival Guide, to be more for when you get thrown into this. So maybe it's going to be a situation like ours where it's been ongoing, but the idea really came after a friend of mine, or my daughter's friend, went in for what they thought was a routine appointment and found out this little 4-year-old had cancer. And we found out those parents are sitting at the hospital. And so my husband and I went to Walmart and we walked around and we're like putting a care package together for the parents of everything that when you don't have it at 2 a.m., you lose your mind. Floss. That is silly as it is. Floss has been one of those things. And while we have an amazing children's hospital here, their gift shop is pointless. It does not have supplies for families. And so toothbrush, toothpaste, shampoo, dry shampoo, all the things that you're just trying to take care of your child. And when you don't have what you need, it's the straw that breaks the camel's back. Yeah. I've been there a lot. And figuring out kind of what parents need, both to understand this process, understand what's going on. But I finally realized I don't have to live in fight or flight only. So I would get so sick of people saying, oh, I just can't catch a break. I just can't catch a break. And finally, I'm like, no, we can't. But if I sit here waiting to catch a break to function, this isn't going to work. Like, I'm never going to function. And so sometimes we're just along for the ride of the circumstances, 100%. Nothing we can do about that. But we can figure out through all that work we've talked about, how do we at least try to be present in some of the moments? And that means feeling the really hard as much as feeling the really good. I've done some coaching with a couple parents as I've kind of prepped this material. I'm walking through it and we can't selectively numb. So when they are trying to selectively numb the hard, when they will not name the fears, they're not feeling the good. And yet our kids bring so much joy. Watching resilience in our kids. I mean, both my kids will put up with so much more than I ever would and come out of it laughing. Like it's a gift that kids have that we can lose as adults. And so my son he's the delight of the 8th floor. Nurses will come in to see him every time they see his name on. They may not be our nurse, but they'll come in to see him and check on him. And I know that part of his journey and mission is to be the joy for them. He's a case they get to see go home a lot and come back, but he gets to go home. And I know that. And so the journey for parents is unique, but when you've been a medically complex parent, you have a lot in common that you don't know that other people necessarily understand. I got to have coffee with one the other day who is, and just for me to recount a phone interaction with someone that drove me nuts, she got it instantly why it drove me nuts. And I'm like, that's the difference. I don't have to spend 5 minutes explaining to you why that drove me nuts.
You're already there. Yep.
You get that. And so kind of understanding that, and then the last piece, I guess I'm currently doing research with my research partner and friend to look at parents' coping ability and family quality of life, because the literature does show us that if parent can't cope well, we're not the attachment figure our child needs to cope well. So we have to do that work, and it is unimaginably hard. Yeah. Especially to do that in the middle of all this. Like, I mean, to give you the mental picture, I'm talking nights where we didn't sleep, that I'm on the couch with him crying, listening to scripture because that's all I knew to do. Like, it comes out of moments like that. It comes out of walking the hallway in the hospital after just being thrown up on and saying, oh my gosh, I can't do this. This is not supposed to be this hard. And it has to come out of those, because if you just ignore those, if you ignore all the time, there's room for distraction. But if you ignore all the time and you don't turn into that, you won't see the peace and the joy and the goodness that comes out of it. You won't see those people who needed to see him today. The nurses that just needed that hug and 100% pure laughter. You won't see that. You won't turn into.
That's so good. I get the picture of the river again that we were talking about earlier. And, I think when we talk about kind of being in this kind of authentic self place, which what it sounds like you've really worked into is, your parts, your triggers, kind of moving in and out of that window of tolerance, what that feels like. And I think we get this picture sometimes of being in that river and flowing down the river as if like maybe I'm on a tube or something. No, that's not it.
No, you're
not
your head above water sometimes.
Right. And there are like trees up in the middle of the river, and you've got to like hit one and do a spin move, and like,
Yep.
it's not a Saturday on a tube like with your drink going down the river.
Well, that just gave me a totally different image, but totally relevant. I play Mario Kart. It's like the only game that I'm even.
I love Mario Kart.
Decent at playing, and my 4-year-old has gotten rather obsessed with it. My husband can play without any of the bumpers, but if I play without any of the bumpers, it's a disaster. Nothing will happen. But I can turn on bumpers, and I can turn on these things, and so it's fun. I am bumping into things and swirling around or whatever, and because I can't go off the edge.
Yeah.
And so we've gotten her to start playing, and we put all the bumpers on, and occasionally she's just sitting there with it in her lap. She's not actually doing anything, but because it's got auto go and because it's got bumpers, she's just doing stuff. And I'm like, I wish it would be that easy. Like, but most of the time it's like, oh, look at that. But there is a limit of, I know I'm going to be okay.
Yeah. And you still feel the flow of the water around you. Yeah. Yeah.
You know that you're where you're supposed to be and you're not striving. I mean, in my prayer time a couple days ago, I was like, what do I need? And he said, just rest. Wrap this up, because I looked up the word striving. He said, don't strive. And so I'm a word nerd, an academic. And so I went and I said, okay, what does striving mean? So he said, just rest, don't strive, sit still, stay in now, rest when you can, fight and push when needed. Stay in this moment, because that's where I am. You don't have to do anything to make sure you hold on to me. Just don't go away from me. And so I looked up the word strive, and it says to devote serious effort or energy to struggle in opposition. Synonyms with toil, strain, slave. And it comes from the word strife, which is a bitter, sometimes violent conflict, exertion, or contention for support. And like that, just that idea of like grasping at the things, trying to get out of the river, trying to hold on. To me, that's striving. And it feels completely unproductive. I don't feel like I gain anything from it but stress. Even if I feel like I'm going down the river at a way faster pace than I want to be, it's comfortable because I know that I'm going with it.
You're in the moment of it. Like the striving is trying to escape the moment. And like you said, that's so beautiful to be able to just kind of learn and when I say learn, I'm saying like you're doing the work to be able to. I think it's a fight to stay in the moment at first, but once you do that over and over, you realize like the moment is what you're called to be in.
That's where he is.
That's where he is. Yeah.
And the verse that he gave me at that time was from Galatians. If obviously I'm not trying to win the approval of people, but of God. If pleasing people were my goal, I would not be Christ's servant. But even before I was born, God chose me and called me by his marvelous grace. It pleased him to reveal his son to me so I would proclaim the good news. Like, he has purpose, and this is where you, like me, we do counseling with anybody that wants to walk in the door, but Faith Integrated is a big piece for me because it's where our identity is. I mean, I would not have survived this far. Like this morning as I was praying, I was like, what do you have? I look back and I see God's hand on my life from the beginning, before I knew it. I see that call. I see that it's why I can understand the things that I can. And I'm excited to be working on these books. I mean, they're in outline format, but I'm a writer for fun, so probably within the next year. And then one for counselors as well on kind of how to treat. I already get to present to like OT, PT speech with my friend about trauma-informed practice, like how they can use this understanding of the impact of this on the families to support the families and therefore improve treatment for their kiddos that they're treating. But to just figure out that we can work with this. We can help with this. A lot of counselors shy away from grief. They don't know what to do with it. But if you can just recognize it, it's just part of life.
Gosh, you're amazing. Tell people where they can find you, because I know when people hear this, they're going to want to connect.
Yeah, so hopefully the Forgotten Patients is going to launch in the next month, but my advocacy platform is called Empowering Hope. So you'll find Empowering Hope on Facebook, and I believe on Instagram it's Empowering Hope TIC, which is Trauma Informed Care. And then, yeah, the podcast should be showing up soon. Parents that have gotten patients.
Awesome. Well, thank you for all of this. I really, really, really appreciate your time today and you sharing your story and yourself and your wisdom with us, for sure.
Right.